I mentioned the public health model, and it's really the same approach that's used for other diseases. It's defining the problem, which is actually one of the strengths of CDC, is looking at surveillance data and figuring out what the problem is. Identifying the risk and protective factors for injury. What helps someone avoid injuries? Why do we know that somebody might not be at risk for an injury? And what are the risks that actually exist? You know, is it age? Is it lifestyle? Is it alcohol use? What kinds of things increase the risk for injury? Determine what prevents the problem. So what works? What can make a difference? Whether it's a policy initiative, a program initiative, or some other intervention, what helps to decrease the problem? And then prevention, and that's implementing and disseminating evidence-based solutions to injury. Some examples of this: we've defined problems on child maltreatment. We've developed uniform definitions along with other federal and non-federal partners, and we're currently doing this for abusive head trauma. We're also doing some definition of mild head trauma so that we can have some consistent definitions so that when we do surveillance we can understand better what we're really looking at. Identifying risk factors. I mentioned the National Violent Death Reporting System. It's one of the several data systems that help us understand the injury problem. Determining what works. That's some of the research that we do and that we support. We know that graduated driver's licensure laws are effective in decreasing crashes in youth and adolescents. So we are doing work that will support the dissemination of those strategies. Falls prevention in older adults. We know that there's things that work to help people avoid falling and help prevent them from falling, such as exercise that helps them maintain balance and strengthens their muscles. And then another example in child maltreatment is the positive parenting program, which encourages safe, stable, and nurturing relationships through a model that includes various parts of the community, not just the public health programs or public health department. And then we know that in all of our dissemination and implementation of solutions, that partners are one of our key requirements in order to make these successful. The core state injury programs are one place where we've seen this. For example, 2 states improved their child safety seat laws based on evidence on age and height of children who should be in booster seats. And we've done that with the core state program. We also know that research really needs to move to practice, but practice also has to inform research. We really need to know what's happening out in the real world in order to develop the research questions that we need to answer to help practice get better. So we've had demonstration projects in the positive parenting program. The abusive head trauma, there's demonstration projects in that area as well. And they're still going on. We're doing some evaluation. We've had an ignition interlock community guide, and what that means is it's basically a publication that comes out of CDC that provides the evidence for why these work and what the strategies can be to implement them in the community. And the ignition interlock is something that's used to prevent impaired driving, alcohol-impaired driving. Motorcycle Safety Guide was released in March of 2011. It provides the evidence base for motorcycle safety initiatives, including universal helmet laws. Prescription drug monitoring program evaluations. We've completed evaluations of these in several states to determine their effectiveness, and now we're trying to identify what components of PDMPs are the most effective components so that we can help states to implement them rather than moving to implement things that maybe are not as effective and may cost more money. Return to play laws. Many states have implemented return to play laws based on the sports concussion issues that we're seeing, and we're now looking at evaluating the implementation of them to identify how is it best to implement them, and then we need to look at the outcome of these laws and find out whether they're having an impact on decreasing the risks that might occur for a young athlete who gets hit in the head or suffers a concussion. We think the investments in injury and violence prevention are certainly important and certainly of value. We know that we have these evidence-based interventions and they save money. So for every $35 that's spent on a booster seat, we reduce the cost to society by $2,500. I mean, that's a great investment and a great return on the investment. Smoke alarms, where I think we've had a lot of success, and I know Mary Kay mentioned sprinklers, which I know is one of her passions and one of the things she's really pushing for, but even smoke alarms, battery-operated smoke alarms, really make a difference. The cost of treating somebody with a burn or a death in a fire are really significant. So $44 for a smoke alarm, $770 benefit. The same with the interlock devices, graduated driver's licensure, treatment guidelines for traumatic brain injury, and the positive parenting program. So we have evidence that these all make a difference. With graduated driver's licensure, we know that there have been these decreases in fatal injuries in 16 and 17-year-olds, and the drop has been greater than 50% in the last 10 years, which is what this graph illustrates. So they're a key contributor to this decline. Certainly safer vehicles and increased restraint use make a difference as well. So what can we achieve through basically putting this emphasis on research and practice and their linkages? We can inform policy through data and evaluation. We can build and sustain partnerships to implement these interventions. We can create the linkages between research and practice, public health, and the healthcare system so that we have a health system, not a healthcare system, but a true health system. And we know that partners are key in our success, and that if we work together, we can put injury and violence prevention on the map as the premier public health achievement of the decade. So I'd like to thank you for your time and for listening, and let you move on.
And she'll be back.